Well, hello. I'm Dr. Ken Tombley, and I'm going to be presenting today to you an overview of a relapse prevention model that was developed by Terence Gorski. This is the relapse prevention model and the core treatment model that we use at Turning Leaf. And you've been asked to watch this so that you can become aware of it and how we not only establish it as the foundation, but how we integrate it into a series of services from psychoeducational group therapy to individual counseling. Also, you will be seeing a little bit of how we take a model presentation so that we can measure fidelity of our treatment services and allow it full personal individual adaptation. So in this hour, what you're going to see really is just kind of an overview. We'll talk about how the model perceives addiction. We will then talk about some of the key elements that are connected to recovery and how it is a process. And then we'll talk about the relapse cycle and understanding relapse not as simply a return to use, but actually a process that begins subconsciously and then ends up in reuse. And then in later sessions, we'll really kind of examine that relapse model in more depth and be able to talk about how we can intervene in that and prevent a relapse and extend someone's sobriety. So let's begin with a little bit about Terence Gorski. He developed this model in the 80s. It's been heavily researched and is supported by our major institutions that do addiction medicine and addiction research. He was assigned the task of dealing with treatment-resistant or repetitive relapse set of clients in a hospital setting. And then from that, he began to put together his understanding, do some research, and he developed the Center of Applied Sciences to do this and has kind of led the way. What I think is wonderful about this relapse model is this is a clinical approach to treatment, but it definitely correlates very strongly with mutual support groups, whether they're faith-based or whether they're traditional 12 steps or modified 12 steps. And for many people, integrating in some kind of external mutual support group of some type becomes a key place, and then being able to keep their addiction in remission. And so it's wonderful that the clinical element is not contrasted to the mutual support group, but actually there's a cohesiveness between the two. And it's one of the primary reasons why this model was selected. I would say on a personal note, when I took over the directorship of a treatment center, coming from the mental health side, I visited with a number of people in the community that had 5 to 7 or more years of sobriety, had gone through, and I asked them what was the kind of the approach that really was successful for them, and they all pointed to this book from the 80s, Staying Sober, and discovered that that was actually Terence Gorski's kind of core text for this material. And so this comes from kind of also an endorsement of the consumer, not just an endorsement of the clinician. So Gorski understands addiction as a disease. And so I put up the American Society of Addiction Medicine's definition of addiction. Addiction is a treatable, chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People with addiction use substances or engage in behaviors that become compulsive and even continue despite harmful consequences. Prevention efforts and treatment approaches for addiction are generally as successful as those for all other chronic diseases. So there's some key pieces in here. And as a provider working with a population that struggles with substance use, being able to help them understand what's going on inside of them is a key part of that. So understanding a definition of what is their this thing called addiction that they have. So first of all, it's a chronic medical disease, meaning that it involves the body. It's not just simply a character issue. It's not just simply a lifestyle. It's not simply a thinking framework or a psychological framework. It's an integration of what's going on biologically and psychologically and socially. So it's a biopsychosocial disease, and it hijacks the brain, causes the brain to involve itself in compulsive behaviors, regardless of the consequences. So even when people that are addicts want to choose something different, they find themselves choosing their substance or their addictive behavior. So understanding that recovery is going to involve us dealing with the biological part of ourselves, the psychological part of ourselves, and the social or spiritual part of ourselves are all part of understanding what addiction is. And so we kind of say it this way, that your brain has been hacked, hijacked, and you're hooked. And these are ways of thinking that you can't just decide today, okay, I'm in treatment, so now I'm going to stop using. That treatment isn't about deciding to stop. Treatment really is about changing both your body, your brain, and your heart. At Turning Leaf, we say you're in your first stage of recovery. You're here to reboot your brain, your body, and your heart, because the addiction is a whole disease. It develops in cyclical patterns, and there's several wonderful illustrations to talk about addiction. It begins with an initial use. Then there's a sense of abuse, meaning that you're using it excessively and repeatedly, and your body then begins to develop a sense of tolerance to it. And so that tolerance means you have to have more to get the same result. Then there's a switch when you move from tolerance to dependence. And when you're switching, you're going from a positive reinforcement, hey, this does something I like, to a negative reinforcement that if I don't keep doing this, then I'm going to be miserable. So addiction moves further in the cycle when now you need to have that in order to maintain a sense of balance. So you've readjusted where your sense of balance is, or your baseline for mood, and your baseline for adaptability, and your baseline for tolerance of external stressors. And your body says, look, I'm just going to have more, need more of that if you're going to expect the same kind of result. And then from dependence, where you are saying, I have to have it to almost feel normal, you're holding on to it, and then life begins to degrade. And you find that you are increasingly more compulsive. So even though you're willing to be uncomfortable, you're finding that you're choosing your substance or your addiction behavior, you're choosing it regardless of consequence. And that's when you know you're kind of all the way around to that stage of addiction. And then that addiction is full of relapses. Times when we say, okay, this is enough. I know I've had enough. There's like these little moments of clarity. However, those moments of clarity get eroded quickly when other stressors enter and our brain says, nope, we're going back to the substance. We're going back to the behavior, and we need to go back even more intensely. And then we're back around and back around again. So there is a developmental nature in many clients' experience of addiction, although there are some of them that would tell you they used opiates as a pain medication one time and they were immediately dependent, immediately addicted. And they will talk about it that way. They just went through the cycle pretty rapidly, or they have some strong genetic predispositions to that particular type of addiction. You have heard some of those stories revolving alcohol as well. But typically, there is kind of a progression. In the client population that I work with, often you'll find that addictive cycle began early in adolescence. So our key phrase, and there's several key phrases that we use to describe addiction and the recovery process. Here's one key phrase: your brain has been hooked, hijacked, and hacked. And there's some specific things that have taken place in the brain. So when you are finding someone who and working with someone that has a substance use disorder or an addiction, you'll find that what has happened is the brain has been hijacked. There are three primary systems that have been modified because of the substance use. And so you have first the basal ganglia area. In the basal ganglia area, that's where learning and reward and habit are kind of connected. This is the recepting place for dopamine, where there's a sense of desire, safety, or inhibition. It's also where the thalamus is, where there's a sense of kind of how you handle arousal, how when things kind of become alert, and how you deal with alertness, and then all the way to the ventral tegmental area. This is where dopamine is actually synthesized, or where it's actually made. And so in that early stages of addiction, what's happening is this part of the brain is kind of being rewired, and being reset, and all the processes that are associated are being kind of reset. And you can tell that when someone binges or they're in that intoxicated state, they are being driven by this section of the brain, or this system in the brain. And that system of brain is continually being modified because of the intoxicated effort. The second section is the extended amygdala, okay? And this area is where memory and emotions, most notably anxiety and fear, okay? And these are kind of the constantly areas that reward, when there's a reward deficit or there's a stress increase, this part of the brain suddenly goes into action, and it causes you to alertness and intensity. And that's one of the reasons why when your basal ganglia says, look, I really need this, and then your extended amygdala system says, wait a minute, you don't just need it, you have to have it, and we're going to short circuit the system. We're going to subvert the other part of the brain that would calm you down, and that is the prefrontal cortex. In the prefrontal cortex, that's where we kind of think through things. We weigh consequences. We slow our impulse. We manage our impulse control, and the prefrontal cortex becomes to be deficit or shut off. And so what happens? The extended amygdala system says, nope. Prefrontal cortex, we're shutting you down because we got to deal with what the basal ganglia is demanding. And these are processes that are just happening. We're not necessarily cognizant of how they're happening, but they definitely are happening in addiction. And this is why people have good intentions to stop using. They have desire to stop using, but they can't. It's also why they go from getting a positive reward to a negative reward. They're just trying to maintain some sense of balance. And the graph on the lower corner kind of explains why they feel this sense of, I just need the substance in order to maintain a sense of normality. You see the baseline mood there. Let's say that that's the baseline of where someone would have a general sense of mood and a sense of well-being, and things are okay. All right, that's the homeostatic point right there. And generally emotions move kind of up and down, really close to that baseline. But when you use substances, you are moving arousal way up and then way down. You're going way past that baseline in both upward motion, or an excited emotion, and a depressed kind of emotion or a mood. And over a period of time, as the brain adjusts, it actually moves that baseline of mood, doesn't go from that balanced baseline, but it goes to an allosteric or an allostatic state, which is an altered baseline. And that baseline gets altered because substances impact on the brain does a couple things. First of all, dopamine and GABA, two very primary neurotransmitters that are needed for a sense of peace, contentment, reward, happiness, logical thinking, etc. Those decrease. All right. So as the addictive cycle and those three systems take over, then these neurotransmitters suddenly, not suddenly, but these neurotransmitters are no longer producing the way that they should be produced, or they're processed the way they should be processed. And so you have less and less. And so you get this altered state. And on top of that, you have stress-related hormones and hormones that are related, or neurotransmitters that are related to actually to aggression, are actually increased. So you're flipping the system, okay? And by, that's why we say you're hooked, hijacked, and hacked. Your brain is trying to reprocess itself, shut down the prefrontal cortex, and limit its ability to subdue your impulsivity, and at the same time heightening your aggression and robbing you of joy. And these are chemical processes that are taking place in the brain. And this is what addiction is. And not only do clinicians need to understand this, so that when they look at what they're doing to treat this, so that they're treating the whole body, not just the value system of a client. Hey, you shouldn't use drugs. They need to be treating the entire body, whether it's in residential care or whether it's in outpatient care. So we've said that addiction is a chronic disease. We've showed you a little bit about what is going on in the brain, but chronic diseases do not get better. They do not go away. They simply go in remission. That means there's a measure of improvement that happens that can be restored, and sometimes to like even a healthy state. But if you stop management or you stop treatment of the disease, it's going to return. And that's the key element to understand in substance use disorders, that if treatment stops, then it will return. And we find in studies that addiction responds just like other types of chronic diseases. So for example, here's a comparison of hypertension. If you have a severe case of hypertension and you provide treatment for hypertension, as long as you're providing treatment, then hypertension is not a problem. If you remove treatment, hypertension can return. The same with addiction. If you provide treatment, maintain that treatment. If you stop treatment, then addiction returns. So understanding that a client and helping the client accept the fact that they have a chronic disease is part of the process. In fact, it's kind of one of the big hurdles of someone acknowledging, I didn't just make some bad mistakes, but I now have a chronic disease that I'm going to have to manage and deal with for the rest of my life. This can have a sense of grief to it, can have a sense of shame to it. It can have a strong sense of resistance that surely this cannot be true. And that's honestly the case with every chronic disease. However, when we study it, and we've been studying it well for over 100 years, we see that this is exactly really what happens. Even when someone is doing very well in a 1 or 2 year period, they can return very quickly back to the issue. And I can give you another little example. For example, nicotine addiction. When you start using nicotine and consuming it in higher volumes, not only does your brain adjust to the nicotine as it does with any substance, your brain actually grows or develops additional nicotinoid receptors. So just for illustrative purposes, let's say you had 100 prior to smoking. By the time you smoked a pack a day for a year, then you've got 500. And so this idea of increased numbers of receptors is the why you want more and more nicotine. And then you decide to stop. Well, what happens is nicotinoid receptors don't then dissolve and you move back to 100 receptors. You still have those 500 receptors. They just lie dormant. And so 10 years later, you can pick up a cigarette and all of a sudden start activating or lighting up those receptors. And then all of a sudden you're wanting more and you're right back to where you are. And so that's why there's a chronic nature to this disease. And we want to frame treatment in that framework, that this is about putting your disease into remission, and you can successfully put it into remission. So let's kind of look at what its remission rates or relapse rates for chronic diseases. You'll find that drug addiction actually has a better success rate than hypertension or asthma. Hypertension or asthma, 50 to 70%. Relapse rates or return to problem rate. And addiction, you're 40, 60%. Type 1 diabetes, 30 to 50%. So we need to be thinking about addiction in these three terms and helping clients think about it so that they adjust their life, just like you would adjust your life for any of these other chronic diseases. So how much relapse really happens? That's a question I think a lot of people talk about. They talk about, treatment isn't successful. And when we understand it's a chronic disease, then our definition of what's successful begins to change. But let's look at what research has found about how much relapse really happens. And that can help us understand what role relapse plays in the treatment process, or what role relapse plays in the recovery process. So the National Institute for Drug Addiction, they did some outcome studies. So basically they're tracking people that have gone into treatment and following their course of recovery. And the data shows from the NIDA that 40 to 60% will return to use within the first year of treatment. So in that first year, 40 to 60% of the patients that are receiving treatment are going to actually have a reuse. And of those 40 to 60%, 60% of those are going to have multiple reuses in the first year. So that this is an indication that relapse is a huge part of actually recovering. What's also interesting is that this study done by the Center for Substance Abuse Treatment did a long-term study on abstinence, and they discovered that 50% had sobriety periods of 1 year or longer, and 30% or 29% returned to use after 3 years of sobriety. So 50% of them could go a year with sobriety and then have a reuse. 30% could go 3 years without reuse and then have a relapse. So relapse is part of recovery. And that's another phrase that we try to say, look, relapse doesn't mean failure. Relapse doesn't mean you don't care. Relapse just simply means that you have to manage your disease differently, and that you have to be more aggressive about pushing it back into remission. So it's important to understand that Gorski defines terms very specifically, and he has a philosophy about recovery that kind of shapes the movement that someone takes through the process of recovery. First is understanding abstinence, or to abstain, to not use a drug. Abstinence is not recovery itself. To choose not to use a drug is simply to be able to stop the intake of that substance, but not change necessarily any of your behaviors. Some people view treatment as abstinence. I just have to abstain and not use. However, they aren't changing anything else in their life. And because they don't change anything else in their life, um, their period of abstinence can be very, very, very short. I hear people tell me all the time, I'm just done with drugs. I'm over. This is it. I know I'm not going to use again. When people say those type of things, they're typically thinking of recovery as simply, I'm just stopping use. They're not understanding that they have to treat their whole body and they have to reorder their brain, and that the brain has been hooked, hijacked, and hacked. And so they're just going to say no, say no, say no. Some can say no for weeks. Some can say no for 30 days. Some can say no for 3 months. Depends on the severity of their case, how long they can say no. But if abstinence is viewed as the definition of recovery, then their failure rate is going to be a lot higher. But abstinence, as seen as just the beginning of recovery, is something different. So Gorski believes that you have to commit to abstinence, but you have to go way beyond abstinence. And that you can't choose harm reduction, you have to choose abstinence. And you have to choose abstinence across the board. What are all the compulsive behaviors? So if you've used multiple substances, I've used marijuana, methamphetamine, and opioids, you have to choose to stop all of those and not simply stop one of them, because they're all part of the addictive cycle in the brain. I would even argue that you need to look at the impact of nicotine in that addictive cycle, and that you should seriously consider that nicotine is an addictive substance. It has compulsivity to it, and that you are weakening your chances of putting your addiction in remission by continuing your nicotine use. You could also say this about some of the results of sugar, but we'll get into that later on when we talk a little bit more about diet. The important thing here is to realize that this is an abstinence-based program. This is not a harm reduction. We don't want to go from 6 uses of methamphetamine a week to 2 uses of methamphetamine a week. We want to start with abstinence. And you begin with that so that it puts your body in withdrawal. And it's in that withdrawal process that you begin to reorder what's going on in your body and in your brain and in your heart. So recovery is not abstinence. Recovery is living a healthy and fulfilling life without negative behaviors. And that's, I think, a key phrase for us to understand and to consistently say over and over again. Recovery is living a healthy and fulfilling life without negative behaviors. And so it has a positive understanding to it, a positive focus of it. So it isn't, hey, did you use? It's, hey, is your life healthy and fulfilling? Recovery is putting our disease into remission, like we have said over and over again. So I want to just go to a short little video that you can watch from someone in recovery that talks about their need for seeing recovery as far more than abstinence.
What's up, guys, and welcome back to SoberTube. Today we're going to be talking about the difference between abstinence and real recovery. Abstinence is putting down the drug and every single day trying not to use it. Recovery is taking our disease and putting it into remission. Now, let me explain that to you in English. A lot of people, and I'm guilty of this myself, we get out of rehab and we spend every single day alone trying to fight the urges that we have to use. But when the stuff hits the fan, when something bad happens, when we get fired, when we get hired, when we get nervous, when we go to a wedding, the addict in us gets turned on and we use. Because abstinence is just how strong can I be today to fight this thing? And that's what it is. Abstinence is a constant battle to not use. And everybody says, oh, I'm going to get really strong and I'm going to fight the urge. abstinence is really hard. The most clean time I ever put together with no program, just using abstinence, was 60 days. And the way I celebrated that 60 days was by saying, well, I think I'm going to get high because I've proven to myself that I can do this normal. I can get high like a regular person. And every single time that I try the program of abstinence, which is basically just I'm not going to use today and I'm going to do my best to keep myself sober on my own, I always failed miserably. Now, I can't say that abstinence doesn't work. Maybe there's people out there that can use that. I'm not one of them. I am a hopeless, hardcore addict, and I know that there's tons of people that are just like me. Now, recovery is a whole different ballgame. My last rehab, I said, man, I can't do this alone, and I really need help. And every single night at 8 o'clock when I was in rehab, I met addicts just like myself that had put together a program. They had done this whole list of things that I really had no interest in doing. They told me, we want you to get a commitment. I don't want a commitment. You got to get one. They told me to get a sponsor. I'm like, really? I got to hang out with some dude who's going to read me this book that was written back in the day. I don't want to do this. You got to do it. Brian, had to learn how to stay out of my own way because I think I know better. I think that I'm so unique. I think that I can fix myself. Man, if I could fix myself, I would have never ended up homeless and in a rehab. So my program of recovery was, as soon as I got out of rehab, I went to a bunch of meetings and I went back to the good ones and I didn't go back to the bad ones. So step number one, get to a meeting. The next thing I did was I got a commitment. They said, oh, we want you to make this coffee every single night at 8 o'clock. I said, I don't want to do that. Of course you don't want to do that, Brian. If you did the things that you wanted to do today, where would you be? And then I think back, what do I want to do? Everything I want to do is dangerous. I don't know what's good for myself. So come on, keep helping me. All right, I'm going to make coffee. I'm going to go to meetings. I'm going to get a home group. The most important thing I did was the sponsor. I got a sponsor. We met once a week. We read this book. He explained it to me. And I thought, well, once I do my 12 steps, that's it. I'm done. I graduated. And no, it wasn't true. I had a bunch more stuff to do. Now, my program today with 7 years is very similar to my program that I had when I had 1 year and when I had 6 months clean. The only thing that's changed is I share my story with addicts on a regular basis. I go to detoxes, rehabs, meetings, YouTube, and I tell everybody how I got better. Step 12 is I can't keep what I have unless I can give it to you. It's one addict helps another addict, helps another addict. And that is really important. You can't just take it and keep it because it's proven through evidence that I've seen that you don't get long-term recovery if you're not helping other people. That's why I've dedicated my life to helping other addicts. So now we have abstinence, which is I'm going to put down the drugs and do this on my own, and a program of recovery, which is I'm going to find people just like myself, find out how they recovered, copy that, and then I'm going to take it and I'm going to give it to more people. And I've seen so much more quality recovery and quality life and amazing miracles happen to the people that have chosen to do a program rather than chosen abstinence. Abstinence is really lonely. And my program of recovery is the opposite of lonely. I talk to addicts in recovery on a daily basis. And when I have a problem, I call my sponsor. And the reason for this YouTube series is so you don't have to be alone. So you can turn on the TV in the middle of the night or your computer or your iPad or your cell phone and find real recovery. So if you're trying to figure out if you're going to do that annoying list of things that they want you to do, or you're going to do this thing all on your own, just ask yourself, how many times have you been able to help yourself in your addiction? My answer, 0. How many times have I, Brian, gone through this program of recovery, a real solid program, and has it worked? All I can tell you is that it's given me 7.5 years of excellent life, and it could do the same for you. There's no difference between me and you. If I, Brian Gordon, can recover, so can you. It's really just how hard are you willing to work to get what you need? Remember how hard you worked to get high. I remember doing an amazing list of dangerous things every single day just to get my drugs or my alcohol. Imagine putting all of that energy into your program. Imagine putting all of that desire into a program of recovery. If you work as hard on your recovery as you did on getting high, you're guaranteed a great life. And you probably have nothing to lose. So once again, my name is Brian. Thank you for stopping by SoberTube. And how hard are you willing to work to change your life? Welcome to SoberTube.
So your brain has been hooked, hijacked, and hacked. And the process of restoring that damage is about putting your disease into remission. And it's about developing an individualized program of recovery that the client, the patient, or yourself work through so that you can have a healthy and fulfilling life without any negative behaviors. We're going to let you take a break here. This will be the end of the first recording, and then we'll pick up after a break and review some of the last segments that kind of flesh out the rest of Gorski's model for relapse prevention.